my parents had this vision for me. They wanted me to go to medical school, which is crazy. I took that vision and ran with it. So I went to Prince George's Community College. My goal at the time was to become a nurse. The two most important decisions I made professionally was one, becoming a nurse. How did my family respond? You have to remember, both my parents are Nigerians. The image of nursing, not only in Nigeria, but I think across the world, was it's a female-dominated profession, so for a man to consider, and I'm talking over 20 years ago, to consider becoming a nurse wasn't very favorable, but that's changing. But my family struggled with it early. The shortest distance from an academic journey to a professional career that can not only take care of you and your family financially, but give you an opportunity to make an impact today is nursing. If I were to give a Black man advice today about nursing, I would say, please don't underestimate the possibilities. I am so happy with my path, and I love the fact that I've had the opportunity to impact so many people through the work that I've done. I wanted to be a healthcare administrator, but then I just realized that nursing is so versatile. Like, there's so many different things you can do to impact health and well-being, and this is my calling.
Welcome to the Nurse on Purpose podcast. For the month of June, we're doing something really special, highlighting the voices and stories of men who are making waves in nursing. While nursing has traditionally been a female-dominated profession, it will always be a profession for both men and women, and it is important to show the range, the skill, and the impact that men bring to this field. The quiet strength at the bedside, the bold voices in the boardrooms, the innovators in research, and the healers in every corner of healthcare. This month is for the brothers who have chosen compassion without apology, who wear the title nurse with pride and power. We see you. Every week this month, we're honoring the impact, the stories, and the future of men in nursing, because their presence isn't just valuable, it is vital. So whether you're a man in the field, a student on the path, or someone who simply wants to understand this profession through a different lens, this one's for you. So let's get into it. Welcome, guys, to the Nurse on Purpose podcast. Today, I am honored to have Dr. Bimbola Akintade join us. Dr. Bim is a trailblazing nurse leader, educator, and advocate for the future of nursing. He's the Dean of East Carolina University College of Nursing, a Fellow of the American Academy of Nursing and the American Association of Nurse Practitioners, and a dedicated voice in shaping healthcare policy and workforce development. Dr. Akintade serves on multiple boards, including the North Carolina Nurses Association and the National Organization of Nurse Practitioner Faculty, and he co-founded the network of Black male nurse leaders. His work spans education, leadership, and clinical excellence, making a lasting impact on the nursing profession. Dr. Akintade, welcome to the podcast.
Thank you very much for having me. It's a pleasure to be here.
Such a pleasure to have you. So today we're going to be diving into your journey, really the future of nursing, and the critical role of leadership in advancing healthcare. So let's start off with your journey, because I know you had an interesting journey into nursing. You took the scenic route, right? Just tell me about that full journey.
So once again, thank you very much for the opportunity to be here. It's definitely a pleasure. I really appreciate what you're doing. I appreciate your platform and giving people the opportunity to not only share the stories, but also just to contribute to nursing, and how we highlight the purpose of nursing. So my story is actually interesting. I mean, if you talk to most people, they have unique pathways into nursing. Mine was no different. I'm born to two immigrant Nigerian parents. I know, to two immigrant Nigerian parents. I spent my childhood in Nigeria. My formative years were actually spent in Nigeria, so believe it or not, I had a really challenging childhood. I'm the third child of 8 kids.
Wow.
I went to elementary school in Nigeria. I went to high school in Nigeria, Federal Government College Idoani. Shout out to my high school.
Okay.
Was a horrible student, didn't
Oh,
do very well, had the worst WIAC result in my class, a SAT equivalent.
wow.
I was suspended 6 times
Wow.
in high school and eventually, uh, left Nigeria when I was 19 and came here to the United States. I didn't take JAMB. I didn't even think of going to college. So
Oh.
I left Nigeria, came here when I was 19.
What was you doing getting suspended so many times? Okay, I'm just kidding. We'll talk about that offline.
You know, what I always say is I was misunderstood.
Okay, okay, got it.
I was misunderstood, but more importantly, I just didn't apply myself.
Mm,
Believe it or not. So I came to the United States when I was 19, and my parents had this vision for me. They wanted me to go to medical school, which is crazy because nothing I did should have given them the impression that I would have been successful in medical school. And somehow I took that vision and ran with it. So when
mm,
I came here from Nigeria, I landed in Maryland, and I lived in Maryland for 26 years.
wow.
So I went to Prince George's Community College. My goal at the time was to become a nurse, save enough money, and then pay my way through medical school. It's not a good plan, put it that way. But I didn't have mentorship, so I went through the associate's degree program at Prince George's Community College, graduated, got a job at Doctors Community Hospital in Lanham, Maryland. And while I was there, I knew I had to go back for my baccalaureate degree. So I went to University of Maryland, Baltimore for my RN to BSN. And I just never left Baltimore. So I got my bachelor's. I went back to school for my sciences so I could sit for the MCAT and get ready for medical school. And after, actually, while I was taking, my sciences for the MCAT, one of my colleagues at work said, hey, we should consider completing the acute care NP program at Maryland. And I thought, all right, if I do that, it'll make me a better candidate for medical school.
Mm,
So I went through the acute care NP program while I was completing my science courses, my physics and chemistry and biochems, and working full time as a bedside nurse. And so when I graduated with my master's, I also completed my prereqs, took the MCAT, did okay. But I met someone in my master's program who is ended up being one of my mentors now, and she's like my mom. She offered students the opportunity to continue to their PhD. And if they did while they were enrolled in a master's program, they would be considered BSN to PhD. And they would shave off 15 credits, and we wouldn't have to pay the application fee. And I thought about that and thought, that was like my major fork in the road. Do I go to medical school? Do I get my PhD? And ultimately, I decided to pursue my PhD because I figured if I went to med school, um, one, that's 4 years of school, 4 years of residency. I'm very driven. I'm ambitious. I'd probably want to, specialize. And after 12 years or so, I'd be at the bottom of one profession versus 4 years from now, I could be on the top of the nursing profession. So the two most important decisions I made professionally was one, becoming a nurse. It
mm.
was planned. And the second one was more intentional, getting my PhD.
Awesome.
So I went to MedStar Washington Hospital Center. I worked as an acute care NP in their surgical critical care department where we cared for patients in trauma, cardiac surgery, neuro, general surgery, and surgical IMC. You oriented all these surgical IMCs and you rotated through. And I was there for about 13 years. While I was there, I came back to get my PhD. And while I was in the PhD program, I was one of those people that always ask questions. Why do we do things this way? And why can't we do it this way? And people would always say, well, if you want to fix that, you got to go back to school.
Mm,
So while I was working full time in the PhD program full time, I enrolled in the MBA MHA program at Maryland. I wanted an MBA. And so I completed my PhD in 2011, along with my MHA and my MBA in 2012.
wow.
I was going to be a healthcare administrator, like that. That was my plan. But then I realized that the scholarship I got for my PhD meant that I had to teach for a year. So I taught at Maryland for a year. My first year was horrible. I wasn't very good. Uh, Personality wise, I'm introverted, a little bit shy, not used to standing in front of a classroom. Hadn't put in a lot of time to learning how to do that. And after that first year, I didn't want to leave on that note. So I came back for my second year, but I was very intentional the second time. I did extremely well my second year. And before I could leave and go back to the hospital, I became a co-program director.
Wow.
So I was learning how to teach, learning how to lead. Third year ended up being full program director. I did that for about 6 years. I stepped out of that role. I went to Nigeria to take care of my dad. My dad was ill. And when I came back, finally I could go to the hospital and be a hospital administrator. And the associate dean position opened at Maryland, and I was encouraged by the dean to apply. And I knew that if I applied for that position, academia would be my track forever. I'm glad that I did that. I applied for that role and got it. I served as the associate dean for the masters at University of Maryland, Baltimore for 2.5 years. And 2 years in, I started getting lots of calls and encouragement to consider dean positions. You get that from headhunters, but when people you serve in national committees would start asking you, you kind of take note. So I applied to 6 different universities. I was fortunate enough. I got 4 offers. And using my MBA, I would always do this, risk cost benefit analysis, and East Carolina University kept coming to the top. And so I've been the dean here at East Carolina University College of Nursing for 2.5 years now. Well, actually almost 3 years, and I love it. So that's kind of my pathway into.
Wow. This is amazing. You have all the degrees, okay? All of them. The only one you're missing now is like a law degree, probably.
Oh, no. No more school for me. I mean, what's actually funny, in 2019, after I came back from Nigeria, I went to Thomas Jefferson University and did a postgraduate certificate in telehealth facilitation. And something interesting happened in 2020, the pandemic. So I ended up serving as a commissioner for health in the state of Maryland, and that certificate came in handy. So we were at the forefront for all the policies in the state of Maryland for telehealth during the pandemic.
That's amazing. Just a couple of themes came up as you were speaking. Mentorship was a big one.
Oh, absolutely.
And then your PhD. What was the focus of your research? Can I just ask that real quick?
Oh, absolutely. So I did a primary study in atrial fibrillation. My mother passed away from a cardiac event, so I'm team cardiac. So I did a dissertation comparing pharmacologically managed to ablation atrial fibrillation patients, and I measured quality of life, depression, and anxiety. So it was a pretty big study. It was a multi-site study. I recruited patients from Hospital Center and University of Maryland, Baltimore.
Awesome. And then the third thing that came up to me was leadership, and of course, the vision that your parents saw, that even when things were looking dismal and somebody else wouldn't have considered your future as a potential to be bright, they saw more in you. And that vision that they saw about you propelled you forward and allowed you to achieve all these dreams. And it felt like this is almost God ordained, because every step that you wanted to take, something else would get in the way and, kind of rise to the top and take precedence, leading you to where you are now. So that's an amazing journey. What a wonderful story. Okay, so focusing on that theme of mentorship, as the Dean of ECU College of Nursing, how do you approach mentorship and leadership for this next generation of nurses?
So that's a fantastic question. I mean, recognizing that in my leadership journey, even as a young leader, there's so much to learn. There's so much to do. And, I always joke that the difference between ordinary and extraordinary is the little extra, but sometimes you don't know exactly what that extra is.
Right.
A lot of people would say you should just find a mentor. but or ask questions, if you're a new leader, people would say, if you have any questions, let me know.
Right.
Unfortunately, as a leader, sometimes you don't even know what questions to ask.
Right.
I think mentorship, creates an opportunity for an individual who has tremendous experience, and someone who has a large network, a mentor can help you sort of have the strategic plan or strategic pathway to your goal, and they can leverage their resources to help you get there.
Yeah.
So you don't have to make the same mistakes others have made. So just like me, I mean, just like you said, I have all these degrees and I went the long scenic route. Now I mentor folks and I can help them find the shortest distance between those 2 points without having to do things the way I did, So I think mentorship is invaluable, especially in nursing, as where nursing is aging, and so the next generation of nurses are not only important to care for people, but they're important to continue to improve upon the image of nursing, so mentorship is absolutely key.
Yeah, wonderful. Now I'm going to transition, kind of talking about your passion project, your baby, right? Health for Nigeria. Health for Nigeria, I know, was born out of a deeply personal experience. Can you take us back to 2016 and what you witnessed in the healthcare system that moved you to take action in Nigeria?
Yeah, so thank you for asking. I mean, I grew up in Nigeria. I tell people, listen, I'm an American citizen, but I tell them I'm Nigerian. I
Yeah.
grew up in Lagos, and I speak the language very well. I'm still very well connected to the culture.
Yeah.
My mother passed away in the year 2000. So this year is the 25th anniversary. She passed away in my first semester of nursing school, and unfortunately I wasn't able to go back for the funeral. It was around final exams and stuff like that. So when my dad was ill, I felt, the personal responsibility. One, I'm the only one in healthcare in my family, but two, I'm also the first son, so I actually went to Nigeria and I was there with him. I was there for almost 2 years. And so while I was there spending time with my dad, it was very important because I had the opportunity to connect with him, but I had a bigger opportunity to see Nigeria as an adult, as an educated adult. I had the opportunity to not only assess or experience the academic landscape, but also the medical landscape in Nigeria, and identify some of those gaps. I came back to the U.S. in end of 2017, so I was there the whole of 2016 and 2017. And when I got back, if I tell you that I couldn't sleep, like I kept thinking about Nigeria, kept thinking about my experience, I kept wondering what I could do to contribute.
Yeah.
Many of us here are blessed. I mean, we have access to basic amenities.
Yeah.
Some of us have really good jobs that have put us in financial positions to be able to care for not only ourselves, but also our families. And I thought, I could do something meaningful in Nigeria. I met someone in Nigeria whose experience, kind of sparked Health for Nigeria. She was the CEO of Teach for Nigeria, Olawe Omikunle, and she had mentioned to me that whenever she would visit the schools that they had teachers in through their nonprofit organization, they would always ask them when they would do something in the healthcare space. And she had encouraged that if I was interested in doing something in Nigeria, I should consider doing something in the healthcare space. So we started Health for Nigeria in 2019. And the goal originally was just to increase access to primary health care for everyone, especially those in rural communities. First, I wanted to do something in leadership, but recognized that, it wasn't moving as quickly as I would like. And then the pandemic happened in 2020. And we came up with this vision. I worked with a gentleman at the time, Mr. Adamovi Oshaw, who he had an MPH from Hopkins and he moved back to Nigeria. And he had recommended that we should consider putting nurses in high schools, so those are public, rural high schools. And if we could place nurses there to take care of not only the children, but the teachers and the local community, that could be a way of increasing access to healthcare. So we started our first clinic, if I remember correctly, in 2020. And today we have 12 clinics in 12 different high schools in 6 states in Nigeria. So that's something I'm very proud of and very excited about.
That's awesome. And that's called Nurse a School, correct?
Yeah. So the organization is Health for Nigeria, but under the Health for Nigeria umbrella is the Nurse a School program.
Yeah.
And it's a program where so we partner with rural public high schools, and if they can give us a space,
Yeah.
and usually they'll give us, a dilapidated space,
Yeah.
we would renovate it. We'll tile, we'll plaster, we'll put in windows, doors, fix the roofs, we'd put in medical equipment. We hire a registered nurse. So this is a nurse-led initiative.
Yeah.
And the registered nurse reports there every day, and they have 5 responsibilities. So they, at the time, COVID, education was important.
Yeah.
Students went home, they were coming back. So we were teaching kids basic hand washing, basic hygiene. Second thing was basic first aid care. A lot of these schools don't have nurses that could help with first aid. Third thing was a school health club. So the nurses actually teach. They teach health promotion, disease prevention, education to the students. Fourth thing, for students with chronic disease processes, those nurses would go to their homes and care for them and their parents, or at least educate them and their parents. And the last thing is once a month, our nurses would go out into the community and would have a community engagement session where we check blood sugars, blood pressures, and stuff like that. So we've been doing that now for almost 5 years.
Wow. Listen, you have your hands in so many endeavors. Really wonderful. How are you able to fund? Like, what do you get grants or any funding for Health for Nigeria or Nurses School, to perform all these rehabs to the sick bay centers and hire the nurses and things like that?
So I'm glad you asked. And, originally I had this vision that I would get endless grants and a lot of well-meaning Nigerians in the diaspora would just, throw money at this. And I would tell you, when I first started, I did get, if you start an NGO, you tap your friends and family, donor fatigue then becomes a thing. So for the last 3 years or so, I've paid for everything out of pocket for Health for Nigeria.
Wow.
And the more clinics we establish, the more expensive it's gotten. Yeah.
Oh, man. What a commendable thing. And I know that there are just maybe people who haven't heard about it, but would be willing to support your work. So I hope that through this podcast, word can get out and you can get the support that you need, because that is expensive work.
I would absolutely appreciate that. And, what I would say to people, for anyone watching, the same way I started this nonprofit organization, I know a lot of people are interested in going back home to do something.
Yes.
One of the things that we all do is we all go home and we start a lot of similar initiatives. Health for Nigeria, yes, you did call it my baby, and my title is founder. So I don't hold any title with the organization. I just want to be recognized as the founder. Today, we have 13 nurses and 4 administrative staff members caring for over 35,000 students so far for free. We've cared for over 10,000 teachers and maybe over 5,000 people in the community.
Wow.
I would love for individuals to support financially, partner with us, collaborate if you have an NGO in Nigeria, but we don't all need to go home and start something new, or put our names in something. I think we can come together and identify, especially a lot of folks here don't have the access or connections or have people there. But they want to help. Like, we would love to partner. We would love to collaborate. We would love sponsors. I want all of us to see this as sort of an initiative that's helping people in Nigeria, regardless of who started it, and just kind of come together and ensure that we're increasing access to healthcare for especially those who can't afford it.
Yeah, that's amazing. And, we've talked about kind of professional development for nursing because there is a stigma when it comes to nursing in Nigeria and the stereotype and, the stereotypical wicked nurse or the subservient nurse that doesn't have like critical thinking skills and things like that. What have you noticed about the nurses that have been working for your organization so far?
That's a fantastic question. I mean, we have amazing, amazing nurses. Um, One of the things I'm proud of, in addition to creating access to healthcare, is just being an employer of labor. I mean, like I'm giving people the opportunity to not only earn a living, but make an impact.
Mm-hmm.
Most of our nurses are young, and it's positive and negative. So I'll talk about the positives first. These nurses are in rural communities, and a lot of people in those communities have never seen or interacted with a healthcare professional ever.
Mm.
So our nurses are their first point of contact to, what structured healthcare looks like. So our nurses are very popular in their communities. People know who they are, which is amazing.
So,
One of the biggest compliments, which is also kind of sad, is, whenever people, have medical emergencies, they rush them to the school clinic because they know there's a nurse there, there's medication, there, resources, So for our nurses, that's amazing. Once a month, we have professional development opportunities for them. I get my colleagues, healthcare professionals here who are international to speak with them. So they have some mentorship, they have some connections with a worldview.
Yeah.
Part of the challenge is there's also a stigma. Even though our nurses are in this nurturing, fantastic environment that gives them the opportunity to grow and see healthcare from a different perspective, different lenses, some of their nurse colleagues look down on them because their expectation is that nurses work in hospitals. So anything outside of that seems, less than essentially, so they struggle with that a little bit, and I've ensured that we've identified several incentives to ensure that they're not missing, experiences from the hospital, and they get a ton of education, which I'm excited about.
That's wonderful. Yeah, we can nurse in every aspect of life. There's not one specific arena where nurses are better or, ranked higher just because they're in that institution. I'm so really glad that you're bringing light to that as well. Thank you so much for sharing. Can you tell people if they wanted to get involved with Health for Nigeria, how they can get started?
So if you want to get involved with Health for Nigeria, we would absolutely love to meet you, partner with you, hear what your ideas are. We have an active website. It's www.healthfornigeria.org. Please go on there. There are ways to contact us and connect with us. Our direct information, email addresses, phone numbers are on there. We would love to hear from you. We would love your support. We'd love to partner with you.
Awesome. But wait, there's more. We're going to transition into the media portion of our podcast with our last 5 or so minutes. Do you watch any medical shows? And if so, what is your take on nursing portrayals in media?
I don't watch a lot of TV, unfortunately. I have to maintain 2 time zones, US and Nigeria, and my work is super busy. But I like medical shows. I think my favorite medical show is probably House, just eccentric. But the portrayal of nurses in medical shows is unfortunately not realistic. Nurses represent over 50% of the workforce for any healthcare organizations. We're the cornerstone, the backbone of healthcare. We're the ones that spend the most amount of time with the patients. I love our physician colleagues and our other professionals. Everyone else seems to know a lot about something specific. The nurse knows
Holistic.
something about everything, right?
Mhm.
And the nurse is responsible, for all the changes, the day to day, time to time changes with patients. I don't think nurses truly get that level of portrayal in the media.
Yeah. Thank you for sharing that. Okay, let's play our game. I'm going to shake my jar, pick a category, and you have to come up with this storyline for
Okay,
for a show movie that features a nurse or a nurse lead. Are you ready?
sure.
Okay, I'm picking it out. Fingers
Okay,
crossed, it's a
okay.
good one. It's drama. Okay, now
I'm
that
like
got
the
it.
I'm
It's,
like the least dramatic person you've ever met.
I
All
know
right,
you
so,
are.
all right. So,
Okay, go for it.
what are the rules? What am I supposed to do?
Okay, so you are supposed to come up with a show. You can title it if you want, a movie. It could be a book, even that features a nurse character or a nurse lead, right? So we've talked about the issues. We don't like the way we're portrayed. Now we want to come up with the solution and do it in a fun way by
Okay.
coming up with our own show. If you could write yours, so go ahead.
All right. So that's wonderful. As a black male nurse in the United States, recognizing that I represent less than 1% of
Mm,
the nursing workforce, and also collaborating with four of my colleagues to start the network of Black male nurse leaders, which creates this platform for Black male nurses to see themselves in the leadership, mentorship, role modeling.
yeah.
If I were to create a show, drama,
Hmm. Hmm.
drama themed show, the lead actor would probably be a black male nurse who, yes, the lead actor would be a black male nurse who, whenever we have our brother to brother distinguished lecture series and we have people come up to speak, every time they speak, everyone has experienced something traumatic in their journey towards nursing leadership. In this drama, there wouldn't be anything traumatic. I think people would recognize that nursing comes in all shapes, forms, colors, gender, and it would be acceptable, that a black male could be not only a nurse, but a nurse leader and serve as a mentor, role model, and actually even, be seen as the picture of nursing.
Ah, I
You know,
love it. Oh my goodness. You,
we can always dream. This is coming from less than 1%.
that was
But we could
wonderful.
always dream.
Yeah, I'm sure a lot of men will resonate with that picture. I was going to close, but I really wanted to ask one last question just because you brought up the whole,
Absolutely.
like, blackmail thing. First thing, how did your family respond when you decided to continue on with the route of nursing? Number two, I know you said being a nurse was like the best decision you ever made. So, any regrets? And number three, did I say one question? I'm sorry, three. And number three, if you could give advice to a man or a black male, African male, by the way, who is looking into nursing as a career but is unsure, feels like he doesn't have any visuals, what would you say? So I got three questions for you. You have
All
1 minute.
right. So, thank you for the three questions. I'll take them one at a time. One, how did my family respond? It was new. It was new to my family. I'm the first in healthcare, and you have to remember, both my parents are Nigerians.
Mm-hmm.
The image of nursing, not only in Nigeria, but I think across the world, was it's a female dominated profession, so for a man to consider, and I'm talking over 20 years ago, to consider becoming a nurse wasn't very favorable. But that original plan, do this until I could get into medical school, was acceptable
Mm-hmm.
until
Mm-hmm.
PhD. And I will tell you, I love my dad. I call my dad the wisest man I've ever known. He struggled with it. He struggled with it for a long time, because he had a different vision and he just didn't understand what the marketplace would look like.
Mm-hmm.
But I'll tell you, he's one of the proudest people today. He tells everybody his son is a professor, yeah. So, I mean, most Africans will tell you, and not just Africans, even Americans would tell you, especially people of color, like it's it's not the go-to profession for men, and so that's changing, but my family struggled with it early, but I'll tell you, I get all the support I need these days. I mean, because it's been, I mean, it's served me the way I would love for it to have served me.
Yeah, awesome.
Your second question was
Any regrets?
any regrets. When I said, becoming a nurse was the first most important professional decision I've made, and getting my PhD was the second, I'll tell you, there are absolutely no regrets. I mean, I am so happy with my path, and I love the fact that I've had the opportunity to impact so many people through the work that I've done. I wanted to be a healthcare administrator, but then I just realized that nursing is so versatile. Like that there's so many different things you can do to impact health and well-being. And this is my calling, becoming a dean, working in academia, just being a mentor, a leader, a role model. I mean, I have absolutely no regrets. I've exceeded my expectation for myself professionally, and now I can just dream and just pursue my goals.
Awesome. Super proud.
And
last question is advice to men
so
enter, Black men, African men, however.
So listen, this is like the best kept secret. I always tell people, African American doesn't matter. From the shortest distance from an academic journey to a professional career that can not only take care of you and your family financially, but give you an opportunity to make an impact today is nursing. Right now, there are probably about 4.5 million registered nurses in the United States. By 2030, about 25% of nurses will retire. There will always be a shortage of nurses. There will always be jobs available. And, for me, right now, as a Black male nurse dean, I don't know that there's 5 Black male nurse deans in the country. I think there are probably 3 of us, maybe. It is such a unique opportunity, so if I were to give a Black man advice today about nursing, I would say, please don't underestimate the possibilities. It's given me the opportunity to do more than I ever thought I would in the professional space.
Wonderful. That's wonderful. Thank you so much. It's been an absolute treat to chat with you, Dr. Akintade. You've been wonderful. Thank you. I know that people listening will gain something so valuable from this. If you could recommend a guest to be on my show, who would it be?
If I could recommend a guest, I could recommend a lot of guests. Okay. But someone I think would be great would be Dr. Ernest Grant. We need to get Ernie on your show.
Yeah, I was getting ready to say, I think he's the other one who's been a dean. But yeah, Dr. Ernest Grant for sure. Thank you so much.
That would be a good one.
Yes.
He's one of our co-founders for the Network of Black Male Nurse Leaders. Actually, we can get all of them on here.
Yeah.
Dr. Jones, Dr. Terry, Dr. Derek Glimph. Yep.
Yeah. I had a chance to meet a couple of them at the Equity and Nursing Summit. So
yes. Dr. Jones, Dr. Carey, and Dr. Grant were there.
Okay, perfect.
Yeah. Just amazing folks.
Thank you. And lastly, where can people connect with you personally if they needed to, reach out, connect?
If you want to connect with me, I think one of the easiest places is on LinkedIn. I'm very active on LinkedIn. Just search my name, Bim Akintade, BIM, first name, AKINTADE. I post several times a week sharing wonderful information about my college and supporting my faculty and staff and celebrating their accomplishments. So you can connect with me on there. I always respond.
Yes, you do. Thank you so much, Dr. Bim. Absolute powerhouse of a nurse. I appreciate you being here today. Thank you guys so much for tuning in. Until next time. Bye-bye. Thanks for hanging with me till the end. I hope you gained some valuable insight into the world of nursing. If today's episode inspired you, Please like, subscribe, and share with someone who needs to hear about the amazing work nurses are doing. Let's keep breaking stereotypes and reshaping the narrative together. I'll see you next time.